Hey guys, welcome back to Neuronify. This is day 5 of our FMT series, and the topic, as you people can see on the screen, is phosphorus poisoning. Extremely important topic and very interesting topic. So, as usual, at the end of the video, we'll be solving MCQs and first understand the topic, learn the topic, and I suggest you people to stop the video and solve MCQs on your own. So, without wasting a minute, we'll start phosphorus poisoning. So before learning phosphorus poisoning, we have to learn the forms of phosphorus. There are two forms of phosphorus, white yellow phosphorus or red phosphorus. Other name of white phosphorus is yellow phosphorus. We'll be learning white phosphorus first. It is white, waxy and crystalline. Now why it is waxy? Because molecules are loosely packed and it is so soft that we can cut it with knife underwater also. We store it underwater because the moment it touches air, it starts reacting with oxygen. It is such a reactive substance. So why we always keep white phosphorus underwater. Number 2, it has got garlic odor and taste. Now you might be thinking, why garlic odor? Same answer, because while oxidizing, it releases phosphine gas with pungent odor, and that odor resembles of garlic. So if you encounter a patient of phosphorus poisoning, then the breath and vomitus of the patient would smell like garlic. So why it has got garlic odor and taste. Number 3, it is luminous in dark. Why it is luminous? Because it slowly reacts with oxygen in air, and that slow oxidation releases energy in form of faint light, which is called as chemiluminescence. So why we see it as luminous substance and dark. Number 4, it is phosphorescent upon air exposure. The moment the white phosphorus is such a reactive substance that the moment it comes in contact with air, oxidation starts. Even faint smoke appears and glowing also occurs. So why they said that it is phosphorescent? It is highly toxic. Why it is highly toxic? Because it damages cells directly. It causes severe oxidative injury, and it especially attacks liver. So your liver, kidney and heart, these are mainly affected organs in white phosphorus poisoning. It is used in rat poison, fireworks and fertilizers. Why it is used in rat poison? Because of its toxicity. Then it is used in fireworks because it burns brilliantly. It is so, I already told you, it is so reactive substance that the moment it comes in contact with air, it catches fire. So why we use it in fireworks. It is used in rat poison because it is toxic, and in fertilizers, it is essential for plant growth. So why we use it in fertilizer. So these are the uses of white phosphorus: white, waxy, crystalline, garlic odor and taste, luminous in dark, phosphorescent upon air exposure, highly toxic, and it is used in rat poison, fireworks and fertilizers. Talking about red phosphorus, it is violet red, amorphous powder. Amorphous is nothing but molecules are arranged irregularly, not in neat crystals. And it is odorless, tasteless, it is not luminous, no phosphorescence, non-toxic, and it is used in making tip of matchstick. We find it in our homes. So red phosphorus, it is completely opposite to that of white phosphorus. We can also see the image of red and white phosphorus here. White phosphorus appears waxy, while red phosphorus appears as amorphous powder. Okay. Then talking about the properties of white phosphorus, as I said, garlic odor, it is pyrophoric. Pyrophoric means it catches fire on own. And spontaneous combustion, luminous in dark, emits fumes and produces secondary and tertiary burns on skin contact. Then what is the mechanism of toxicity? White phosphorus is also called as protoplasmic poison because it inhibits cellular oxidation, hepatotoxic and cardiotoxic, fatty infiltration and necrosis of liver and kidneys, and local corrosive burns of skin and mucosa. So these are the points in mechanism of toxicity of white phosphorus. But very important point is the other name, or it is also called as protoplasmic poison, and it is very highly toxic for liver and heart and even kidneys. Moving ahead, Talking about the absorption and metabolism, it is absorbed better with fatty foods, metabolized to hypophosphate in body, excreted via urine, feces and expired air. So always and always remember that we never ever give fatty foods to a patient of phosphorus poisoning, because it increases the absorption of phosphorus. So this was all about introduction of white phosphorus and red phosphorus. We learnt about the properties of white phosphorus, mechanism of toxicity of white phosphorus, and absorption and metabolism. Then we'll move towards clinical features. So as every poisoning has got acute and chronic types. Number one, acute phosphorus poisoning. So acute phosphorus poisoning occurs in 3 stages, and the duration lasts for 8 to 10 days. There are 3 stages primarily in your acute phosphorus poisoning, but there are no such stages in chronic poisoning. So differentiating feature between acute and chronic is of stages. You'll encounter stages in acute phosphorus poisoning. Starting with the very first stage. Very first stage is called as GIT stage. It stays for first 24 hours. Vomiting, diarrhea, abdominal pain, then garlic odor of vomitus and breath. Stools and vomitus are luminescent dark. Fumes from stools are seen, which is why it is called as smoky stool syndrome. MCQ. Mild improvement may occur, and which leads to which we think as of false recovery. So this is nothing but first stage, which we see in first 24 hours of acute phosphorus poisoning, and GI symptoms are observed, and smoky stool syndrome is also observed, and mild improvement may be seen. Stage 2 is called as latent stage, very important stage because it occurs in 1 to 4 days afterwards, and the symptoms subside temporarily. So do not discharge. We have to take in account that we should not and we must not discharge the patient, because it is very very dangerous phase, because symptoms subside temporarily and we think that the patient has recovered, but that is not the case. That is why stage 2 is called as latent stage. No symptoms are seen in this stage, so remember not to discharge patient. Stage 3 is hepatic failure, late stage. Jaundice is observed, hepatomegaly, inflammation of liver, massive hepatic necrosis occurs, then purpuric hemorrhages, encephalopathy, convulsions, renal failure, oliguria, hematuria, and shock leading to death. So these are the 3 stages of acute phosphorus poisoning, and the poisoning lasts for 8 to 10 days in total. Talking about chronic phosphorus poisoning, it is seen in matchstick workers due to inhalation of vapors continuously. Then phossy jaw is also seen. Other names of phossy jaw are glass jaw, lucifer jaw, osteonecrosis of mandible. So toothache leads to swelling, then leads to discharging sinuses, and which consist of pus and of garlic odor. Osteonecrosis of mandible is observed. Loose teeth, gum slowing is also observed. What is gum slowing? It is nothing but superficial tissue of gums, peels off. It shades or undergoes necrosis, leaving raw or ulcerated areas on gums. So it is nothing but shedding off of superficial tissue of gums. And bone becomes dense, sclerosed in adults. Sclerosed bone is hardened bone in simple language. And how we can prevent it? By periodic dental screening. So these are the 2 points which we need to remember. Seen in matchstick workers due to continuous inhalation of vapors and phossy jaw. What are the other chronic symptoms? Nausea, vomiting, diarrhea, abdominal pain, muscle weakness, anemia, and jaundice. Now, how we are going to manage Talking about the management, do not give milk, ghee, oils, because these substances increase the absorption. Why these substances increase the absorption? Because these are fatty foods. We discussed it earlier. And do not use copper sulfate. Earlier, people used copper sulfate as an emetic to induce vomiting, but nowadays it is completely stopped, because copper sulfate itself is so toxic that it damages the body more than phosphorus poisoning. So doctors have completely stopped CuSO4 use. And what are the treatment steps? In treatment steps, we give gastric lavage, KMNO4 1:5,000, that is 1 gram of KMNO4 in 5,000 ml of water. And KMNO4 acts as an oxidizing agent, so it converts the phosphorus to less toxic phosphates. So why we use KMNO4. Sodium bicarbonate is supportive. It is supportive substance. It is not a primary antidote, but it just decreases the gastric acidity, and it also provides symptomatic relief. It decreases burning sensation. It decreases irritation. It even decreases gastric discomfort, and it also helps in protecting the mucosa of stomach. So why in gastric lavage? But you have to remember that primarily we give K-aminophore as our primary antidote. So in options, if you encounter, then you have to go for K-aminophore. Number two, it corrects coagulopathy, and we have to correct coagulopathy by administering vitamin K. Now, what happens in phosphorus poisoning? Liver is severely damaged, and we know that liver is responsible for producing clotting factors. But because liver now is severely damaged, clotting factors would not be formed, and no clotting factors that means immense bleeding may occur. So, why to correct the coagulopathy, we administer vitamin K also. Third is fresh frozen plasma FFP or blood products if bleeding occurs. So these three are the treatment steps. We learnt about the management, we learnt about the treatment steps, we learnt what are the stages of acute phosphorus poisoning and chronic phosphorus poisoning. There are no stages in chronic phosphorus poisoning, but there are 3 stages in acute phosphorus poisoning, and the duration is 8 to 10 days. Moving forward, we'll now be learning additional treatment or support. N-acetylcysteine is also administered in phosphorus poisoning. N-acetylcysteine, what it does, it replenishes glutathione stores in liver, and it also acts as an antioxidant, and it reduces the oxidative liver injury. It even improves the hepatic blood flow and oxygen delivery to the liver. So why we administer N-acetylcysteine? And you might be thinking, now as I said that N-acetylcysteine replenishes glutathione stores. See, glutathione is nothing but a natural antioxidant, and this natural antioxidant is present in almost all cells of our body, but it is present in higher concentration in hepatocytes, I mean in liver cells. So what NAC does, NAC N-acetylcysteine, it replenishes glutathione stores. So obviously it is going to help liver to get recovered. So why we administer N-acetylcysteine. Then we also give glucose for hypoglycemia. We also give calcium gluconate for hypocalcemia, benzodiazepines for convulsions, and for burns we use topical CuSO4. We use topical CuSO4 or AgNO3. Only for skin burns and not orally given. Why? We know the answer. In autopsy findings, we'll be finding petechial hemorrhages, garlic odor, yellowish green stomach mucosa, luminous vomitus or stools, rare in autopsy. Liver is enlarged, hepatomegaly, yellow, fatty, hemorrhagic necrosis, kidneys and heart, fatty degeneration, lungs congestion. So these are the autopsy findings. And talking about the medical legal importance, accidental poisoning is most common because children mistakenly eat rat poison. Rare suicidal or homicidal poisoning, historically it is used to set fire to postal letter boxes. Wet cloth plus white phosphorus ignition. So I'll explain this point. Historically what people used to do now, they used to wrap the white phosphorus inside a wet cloth, and because of which after some time, after the wet cloth became completely dry, the white phosphorus itself catched fire, which burnt all the letters in the letter boxes. So that was one of the trick or say crime. It was used to do a crime or trick on the people, but yeah, earlier people used to do for the mischief. And in this way we have completely understood what is phosphorus poisoning. Even we have learned the forms of phosphorus, white and red, properties, mechanism of toxicity. Only important point that we need to remember is about the treatment steps and management. Do not give fatty foods. And number 2, in gastric lavage, We primarily emphasize on KMNO4, 1 is to 5000, 1 gram of KMNO4 in 5000 ml of water. So yes, this was all about the phosphorus poisoning. We learnt about the additional treatment, autopsy findings, medical legal importance, types, differentiation. Now it is time to solve MCQs. Very first MCQ. Which form of phosphorus is highly toxic? I urge you people to stop the video and solve these MCQs on your own, and lastly you can check the answers. It will help you. Which form of phosphorus is highly toxic? Red phosphorus, white phosphorus, black phosphorus, phosphoric acid. Very easy question. Pause the video and solve these questions on your own. Obviously the answer is white phosphorus. Other name of white phosphorus? There are two names of white phosphorus if you remember. Yellow phosphorus and protoplasmic poison. The garlic odor, question 2. The garlic odor in phosphorus poisoning is due to the presence of what? Phosphine gas, phosphorus trichloride, organophosphates, or mercury. So the answer is phosphine gas. Which of the following is luminous in dark? Very easy question. No need to read options as well. The answer is white phosphorus. Phosphorescence is seen with, again very easy question, white phosphorus. Which of the following is used in tip of matchstick? White, red, yellow, phosphine. Red phosphorus is the answer. Image based question. Identify the forms of phosphorus. Very easy, shown in images A and B. So without reading options also people can tell the answer. A is white phosphorus and B is red phosphorus. Option B would be correct. A patient presents with vomiting, garlic odor, luminous vomitus in dark. Most likely diagnosis is, again very easy, phosphorus poisoning. Smoky stool syndrome is seen in poisoning by what? White phosphorus. Phosphorus poisoning occurs in how many stages? Phosphorus poisoning occurs in how many stages? Very easy. Acute phosphorus poisoning they should have given. So the answer would be option B. 3 stages, no? We learned 3 stages. GIT stage, which occurs in first 24 hours. Stage 2 latent stage, which occurs in 1 to 4 days. And later it is stage 3 hepatic failure. Fine. 10th question. Stage 1 of phosphorus poisoning GIT stage occurs in first 24 hours. Now only we discussed. 10th ka B. Which of the following is a feature of GIT stage of phosphorus poisoning? Jaundice? Na. Hepatomegaly? Nahi. Convulsions? No. Vomiting, diarrhea, abdominal pain. Option D. Latent stage of phosphorus poisoning is characterized by severe vomiting and diarrhea. Temporary improvement, jaundice and hepatic necrosis, convulsions and shock. Pause the video and solve the questions. So the answer is temporary improvement. That's why we are instructed not to discharge patient. Question 13th. Hepatic failure late stage is characterized by all except jaundice, hepatomegaly, purpuric hemorrhages, convulsions. So the correct answer is convulsions. Question number 14th. Which of the following is least likely in late hepatic failure stage? Least likely. Oliguria, purpuric hemorrhages, massive hepatic necrosis, bradycardia. Option D, bradycardia. Question 15th. Which lab abnormality may be seen in phosphorus poisoning? Metabolic alkalosis? May be seen. Metabolic alkalosis, hypoglycemia, hypercalcemia, hypernatremia. May be seen, they have asked. Option B, hypoglycemia. That's why we give glucose. Na? Question 16th. Corrosive burns in phosphorus poisoning are due to action of strong acid, action of strong alkali, caustic effect of phosphorus, or allergic reaction. So the answer is caustic effect of phosphorus. 17th. White phosphorus acts as protoplasmic poison, Yes. Irritant poison, no. Neurotoxin, no. Asphyxiant, no. Answer is option A. Which of the following is a true statement about white phosphorus? Odorless and tasteless? Mm-mm. Non-toxic? Not at all. Phosphorescent on air exposure? Yes. Used in matchsticks? No. Option is correct answer is option C. I'm solving it little fast because I just want you people to stop the video and solve these questions on you. Question 19th. Which of the following is an absorption factor in phosphorus poisoning? Fasting state, eating fatty food, hypophosphate in diet, or alkaline urine? So which factor absorbs the phosphorus more? Yeah, you know the answer. It is option B, eating fatty foods. Which route is common in chronic phosphorus poisoning in matchstick workers? It is easy. Inhalation. Option B. Early sign of chronic phosphorus poisoning is chronic jaundice, necrosis of mandible, convulsions, hematuria. It is necrosis of mandible. Necrosis of mandible in chronic chronic phosphorus poisoning is due to what? Osteomyelitis, osteonecrosis, caries, or osteoporosis. Osteomyelitis, no, because osteomyelitis is caused due to infection. Osteonecrosis would be the right answer. Necrosis of mandible is nothing but your osteonecrosis. Question 23. Identify the above features A to D seen in phosphorus poisoning. Okay. Observe A. Gum slowing. Observe B. That would be osteonecrosis. C is luminous vomitus. D is corrosive burn. So the correct answer would be option B. We can get confused between option B and D because in B it is osteomyelitis, but we know that osteomyelitis is not observed in phosphorus poisoning. Osteonecrosis is observed. So why we can on basis of that we can solve this image based question. Question 24. Specific treatment antidote for phosphorus poisoning is dimercaprol, vitamin K, N-acetylcysteine, atropine. We all know now. So the correct answer is N-acetylcysteine. Option C. 25th. Gastric lavage is best done with what? Now blindly you can answer this question. It is KMnO4 solution. Now you tell me the ratio of KMnO4. 1:5,000. 1 gram of KMnO4 in 5,000 ml of water. Question 26th. Which chelating agent is not used in phosphorus poisoning? Now this is important question. Dimercaprol, CaNA2-EDTA, penicillamine, BAL. This is kind of important question. Now they have asked which chelating agent is not used in phosphorus poisoning. We need to know that all of them are literally not used in phosphorus poisoning. So the answer would be A, B, C and D. A, B, C and D would be the correct answer. Here it is not given, but I'm telling you that see, phosphorus is not a heavy metal first of all, and so why no chelation therapy is given in phosphorus poisoning. The reasons are phosphorus toxicity occurs due to direct cellular toxicity. The phosphorus directly attacks the cells, and oxidative injuries also occurred, hepatic necrosis also occurs. But the toxicity, we have to understand that when do we give chelation therapy? We give chelation therapy when there is accumulation of metal ion in the body. So while to chelate that metal, we give chelation therapy. But as phosphorus is not a heavy metal, chelation therapy would not work here. So why all the answers A, B, C and D, no chelation therapy is observed or is carried out for phosphorus. Remember this point. So only and only chelation therapy is done for heavy metals. So dimercaprol, CaNA3 or I guess CaNA2O3, CaNA2-EDTA, penicillamine and BAL. These four are not given in phosphorus poisoning. Question 27th. Which of the following is used in management to correct coagulopathy? Fresh frozen plasma, vitamin K, obviously. Platelet transfusion, no. Cryoprecipitate, no. Option B. What is the role of glucose in phosphorus poisoning? Corrects acidosis, helps in detoxification, prevents hypoglycemia, all of the above. Think. One thing we surely know that it prevents hypoglycemia. Even it helps in detoxification and even it corrects acidosis. So the correct answer is option D, all of the above. Topical application used in skin burns due to phosphorus. The one which is not used orally but the one which can be used topically. The one which is itself so toxic that we stopped using it. I gave you a lot of hints. So the answer is option B, copper sulfate. Do not look at the answer key even though it is visible on the screen. Most common cause of accidental poisoning in children is rat poison, ingestion of matchsticks, inhalation of fumes, skin contact. Most common. So most common would be rat poison, option A. Here it is given option B, but it is wrong. The correct answer is rat poison. Children do not ingest matchsticks. So it is printing mistake here. So the correct answer is option A, rat poison. So